All right, today we're cracking open the case file on a real heavy hitter in the medical world, low-molecular-weight heparin. Think of it as one of medicine's most precise tools in the fight against deadly blood clots. We're going to find out exactly what it is, what its missions are, and why the rules for using it are so incredibly important. So let's start with the big question. How did doctors actually fight these incredibly dangerous, life-threatening blood clots? Well, the answer is a class of drugs you might have heard of called anticoagulants, blood thinners. And the one we're investigating today? It's one of the most sophisticated and precise versions ever created.
Okay, let's open up this dossier and get a clear profile of our subject. Low-molecular-weight heparin, or LMWH for short. What is this stuff, really?
So, at its very core, LMWH is a blood thinner. But the really key part is that it's derived from an older, kind of less predictable drug called unfractionated heparin. Scientists basically figured out how to take that original drug and just pull out the short, most effective molecular chains. And as you're about to see, that one little change makes a world of difference.
And here is that key difference. The original drug, unfractionated heparin, is like a tangled mess of all sorts of long and short molecular chains. That tangle makes its effect, pretty unpredictable. But LMWH on the right, it's the refined version. All those long, messy bits are gone, and you're left with these uniform short pieces. And that uniformity, it gives doctors a highly predictable and reliable response, which is just a massive, massive advantage in treatment.
So, now that we know it has this predictable power, what is its primary mission? Let's take a look at the really critical situations where LMWH gets called into action. And these missions are always high stakes. We're talking about things like acute coronary syndromes. That's a big term that covers heart attacks. Or acute deep vein thrombosis, a really dangerous clot that usually forms in the leg. And then there's acute pulmonary embolism, which is what happens when one of those clots breaks off and travels to the lungs. In all of these life or death situations, LMWH is a go-to weapon to neutralize the threat.
But, any powerful tool has to have strict rules. LMWH is definitely not for everyone. We have to understand the red lines. These are the situations where this drug absolutely cannot be used because the risk of harm is just too great.
These are the hard stops, no exceptions. Some are pretty obvious, right? Like if someone has active major bleeding, you're not going to give them a blood thinner. Others are more specific, an allergy to the drug or even to pork products, since that's often where it's derived from. A history of HIT, that's heparin-induced thrombocytopenia, is an absolute no-go. And the same thing for recent major surgery on the brain, spine, or eyes. These are not suggestions, they are critical safety protocols.
So, beyond those red lines, there are also potential risks. You can think of it as collateral damage that can happen even when the drug is used correctly. It's so important to know what the possible side effects are.
Unsurprisingly, the number one risk is hemorrhage. That just means excessive bleeding. It is a blood thinner after all. Doctors also keep a close eye out for thrombocytopenia, which is a big drop in your blood platelets, those little cells that help you clot in the first place. And of course, you can also see simpler things like bruising where the shot was given or other signs of an allergic reaction.
And this right here is why a patient's full medical history is so vital. Even common over-the-counter drugs like aspirin or ibuprofen can seriously increase the risk of bleeding when you take them with LMWH. This is why it is absolutely crucial for patients to tell their doctor about every single medication and supplement they're taking, no matter how small it seems.
Okay, so we know what it is, when to use it, and what to watch out for. Now let's get practical. Let's open up the field manual. How is LMWH actually given to a patient?
While this is definitely not a one-size-fits-all kind of drug, this table gives you an example protocol for a heart attack, and you can see it's all about precision. Notice how for patients under 75, they might get an initial IV bolus. That's a fast-acting shot right into the vein before they get their regular injections under the skin. But for patients 75 and older, nope, that IV shot is skipped completely and the regular dose is actually lower. This kind of careful adjustment based on age and other factors is just key to using it safely.
And speaking of precision, this is a really important special case. During pregnancy, the risk of developing blood clots actually goes up. And it turns out the predictability of LMWH makes it the recommended, safer choice over that older, unfractionated heparin for treating clots in pregnant patients. It's a perfect example of how making a drug more refined can help protect even the most vulnerable people.
All right, now for 3 critical handling rules. These can never, ever be broken. Rule number 1, never inject it into a muscle. It's only given subcutaneously. That means under the skin or through an IV, period.
Rule number 2,
LWH is not the same as other heparins. You can't just swap one for the other, unit for unit. They are calibrated completely differently, and mixing them up or treating them like they're the same is incredibly dangerous.
And rule number 3, keep it pure. You do not mix LMWH in the same IV line or the same syringe with any other drug or infusion. It needs its own dedicated path into the body to do its job right.
So when you look at the whole picture, LMWH took an old idea and made it predictable, precise, and way more powerful. It's a fantastic example of a smarter drug. And that leaves us with a final, big question. As medicine keeps getting more and more precise, how will these smarter drugs, like LMWH, change the entire future of treatment?